people with disabilities, they have so many hurdles, and being able to alleviate any of those hurdles is beneficial.
People with disabilities face many challenges to being able to access oral health care. These challenges often deter people with disabilities from accessing the care that they need. In addition to the lack of Medicaid insurance coverage for oral health care, among these difficulties is the office visit itself, which can induce anxiety for patients. Fortunately, much of the anxiety can be addressed without the need for provider training. The following is a conversation between patients and advocates of people with disabilities and a dental care provider. It demonstrates that providers can take simple steps to improve the patient experience. To start, learn the patient's needs.
That, like, we've had this conversation with you today because it gives people an opportunity, other dental providers, to see like that there are practices that do just they ask just the simple thing of asking your patients, having that conversation with them, spending the time with them to see what would benefit them.
I think the most important thing is to ask the patient what is best for them.
Mm-hmm.
And people with disabilities tend to have special requirements in the dental office that just need to be asked by the dentist.
Mm-hmm.
And if that's, I learned that in school, but I don't think everybody did.
Mm-hmm.
So I know it takes more effort, but you can learn a lot by just listening to what they tell you. And if they like a certain thing, do it.
Yeah.
And if they don't like other stuff, you don't do that. And
Yeah.
then you can get pretty far.
Good communication is key.
I don't like needles to begin with, and that, I associate it with extreme pain when you're shooting me up with a Novocaine. And he goes, okay, well, let's talk this through. And as he's putting Novocaine in, he goes, and he started to wince. He goes, he goes, describe what you just felt. And I said, it's like a electrical charge. And he goes, that means I'm hitting the nerve, and that I'm getting where I wanted to get the medicine to numb everything. That I'm right on the money. That's exactly what I want, and that's why you're feeling that, and that's perfect. And it's like just knowing that was, I find, very much relaxing.
Be sure to explain ahead of time what the patient should expect.
The dentist came in and he says to me, God, your teeth are a mess. And I was like, okay, what does that mean? And he's like, you're going to need about $10,000 worth of dental work. And I'm like, thinking to myself, what? And he was like, this needs a cap, and this needs a crown, and this needs that, and this needs that. And he's just rambling on about all this stuff that I need. And it was like horrifying to hear that.
It happens all the time. And
Yeah.
and I know people are like that, and they're walking out of there in a fog.
Yeah.
And I know they didn't hear anything I said after the first couple minutes. So what we do is we have them back, and we make sure they take little baby steps. We try and lay it out so that it's not like overwhelming.
Yeah.
And you take one little thing at a time.
Avoid overwhelming treatment plans.
And that's another scary aspect for me is, being able to not keep my jaw open for 2 hours because they're, doing 4 fillings. So breaking it down, obviously, into small, a lot of times for me is more beneficial. I know that there are people that would prefer to have everything done at once and get it taken
Right, and
care
that's
of.
what you would,
But
knowing,
yes.
we would assume that,
Yeah.
but if we don't ask,
Yeah,
we wouldn't
exactly.
know.
The patient may need reduced time in the chair. Minimize the patient's alone time. The patient may also want a companion or caregiver to be present.
And leaving them alone for however long. In that case, it happened to be they got down there, and because it was a small town dentist that hadn't seen the patient in a while, and so started chit-chatting. And he comes back and goes, "Oh, I'm so sorry. I didn't mean to abandon you." And I was like, I could at least hear you talk, and I know you hadn't left the building for lunch. He wind up having, like 5 patients that, at different stages, and be bouncing to patient. And that, that was one of Sam's biggest anxieties, is being left alone in the room.
Simple everyday items can reduce anxiety. Headphones, earbuds, and sunglasses can make a tremendous difference for the patient.
do they give you headphones at the office?
Actually, I brought my own earbuds.
Okay, so did they tell you like, hey, you can bring your own earbuds and listen to whatever music you want?
I kind of asked if I could listen to some music on my head.
So you just brought them with you and asked when
Yeah.
the time came.
The dentist, they would sometimes take, I would have my glasses be taken off, so either to stay out of the dentist's way or so water doesn't splash on them, and they put a pair of sunglasses on me.
Yeah. Is that relaxing? To have
Yeah, it's just so the light above doesn't hurt my eyes too much.
Sedation may also reduce anxiety.
And there was that other dentist down in Manchester. At least they gave us that laughing gas.
Yeah.
I remember the one that I had and it was pink and it smelled like bubble gum, so it calmed me down.
Taking these simple steps may help improve the patient experience for all patients.